Hi, I'm Todd, President and CEO at Prevent Blindness. Welcome to our Focus on Eye Health Expert Series. Today, I'm excited to welcome Dr. Michael Chiang, Director of the National Eye Institute, to talk about vision research and its role in advancing public health. Thanks for joining me, Dr. Chiang.
Jeff, great to be here, and thank you for the invitation.
Are there current areas of research in the pediatric realm that you hope come to bear to improve children's vision?
One is refractive error, and I would highlight myopia. It doesn't seem like a hot. You might not think of refractive error as a hot topic, but myopia is reaching epidemic proportions in parts of the world, and the incidence is increasing in the U.S. And there's good evidence that it's gotten worse during the pandemic. And even in this country and in places, around the world, there's a big problem that kids aren't getting glasses, who should be getting glasses. And in fact, Megan Collins at Johns Hopkins has done some really nice work showing that in implementing a school vision screening program in Baltimore, that kids did better in school when they got, eyeglasses. And so, from I guess what I'd call basic science perspective, there are a lot of questions about what are the mechanisms that cause myopia, growth of the eye, and a lot of theories, sunlight, near work, environment, and other screen use. And there's also, as I alluded to here, unclear strategies about how to deliver screening or care at scale. And so one of the things that we've gotten started is working with the National Academies of Science, Engineering, and Medicine, NASM, on a report, on a study looking at those issues in myopia. And I know that's something that you all are very familiar with. I think another issue I would highlight would be cerebral visual impairment. That's something that's really, we recently completed a strategic planning process, a 5-year strategic plan. And this is one thing that really came to my attention during that process. So we published that plan in November 2021. It was our first NEI strategic plan since 2012 that we've published. And anyway, CVI has become the leading cause of blindness, vision loss in children now. And, as a pediatric ophthalmologist, I, honestly would often see these patients and feel like I don't have a whole lot to, that I can offer. I just, wouldn't always know what to do or how to manage them. And I think what that boils down to is that we've got a lot of pretty basic questions about how do you diagnose, classify, how do you manage this disease that's going to require a multidisciplinary approach. Another area I'd say is ROP. That's something that I've been interested in throughout my career. But I would say one other area is amblyopia. Before I started at the National Eye Institute, I worked for 10 years in Oregon at the Casey Eye Institute, and we had a little Peanuts cartoon on the wall in the back, and it had it was Linus or Lucy holding an eye patch, and the cartoon said, "Oh, this has been the standard of care for 100 years." And the patch works well, except when it doesn't. And I would say that our current methods of diagnosis and screening, maybe that's a fair way to say, and treatment work well, except when they don't. And I think that there are opportunities for research that I hope will lead to things like improved screening, improved detection, better understanding of pathophysiology, and better treatments. And maybe that's going to be based on methods like plasticity. So those are a lot of issues, I think, in pediatric ophthalmology.
Well, thank you, Dr. Chiang. Really appreciated the time today. Thanks for joining us.
Thank you very much for having me here, Jeff.